Concussions in sports. The most common cause of concussions are sports related. In the United States, athletes suffer from roughly 300,000 concussions every year. Any athlete in almost every sport is at risk of suffering from a concussion. It is important for athletes, along with sports enthusiasts, to understand the risk and how important this injury can be. Concussions have the potential to cause lifelong mental illnesses or can even be fatal in some cases. Today I will discuss what exactly a concussion is, ways to prevent concussions, and the long-lasting side effects and how to properly treat them. A concussion, according to the Mayo Clinic, is defined as a traumatic brain injury that alters the way your brain functions. Though most concussions are caused by a blow to the head, they may also occur when the upper body along with the head are violently shaken. Every concussion someone gets causes injury to your brain to some extent. According to the CDC, over time, repeated concussions can change chemicals and cells in the brain, including those responsible for concentration, problem solving, and mood. I have had first-hand experience with these changes as I have received multiple concussions throughout my high school sports. Concussions have many distinguishing characteristics that make for sometimes an easy diagnosis. According to the CDC, all of the following are symptoms of concussion. One pupil appears larger than the other, drowsiness or inability to wake up, worsening headache that will not go away, slurred speech, weakness, numbness, or decreased coordination, vomiting or nausea, confusion, restlessness or aggressive behavior, and loss of consciousness. Another huge sign of a concussion is difficulty remembering the events that happened right before the hit or the cause of the concussion. This has all been personal experience for me, as I have suffered from concussions in both football and hockey. The biggest symptoms that were shown in my case were difficulty remembering the events and progressive headaches that I still suffer from today. Preventing concussions can sometimes be a very difficult task. The injury happens so fast and usually without being intended by either athlete. Wearing proper equipment is an obvious answer to protecting yourself from a concussion, but sometimes even the best equipment is not enough protection. Keeping a game in line, usually the job of the referee, is one way injuries can be prevented. Enforcing the rules by making sure athletes are not getting targeted with their head is a huge part of preventing concussions. But it is also a very tough task because the plays and the injury can happen so quickly. Other than wearing proper equipment and teaching proper technique, especially in a contact sport with hitting, education is one of the best ways to prevent these traumatic injuries. It is important for the athletes to understand the severity of this injury and report it if they believe they have suffered from a concussion. Most athletes will worry about losing a spot on the team, looking weak to others, or they might think that it is not a serious thing. The truth is, it can be a very serious and have lifelong side effects. Treatment for these injuries can vary, depending on how severe it is. Some patients may have to stay at a hospital and be watched overnight after being diagnosed with a concussion, and others can go home within a few minutes after being diagnosed. Though some people do not show symptoms right away, they can progressively get worse and the person needs to be able to seek medical attention right away. The most common side effect is a long-lasting headache that gets worse as the day gets on and will not get better. In my case, I suffer from headaches every day, and a lot of the times they turn into migraines, which put me in the hospital because the pain is too much to handle. Concussions can also cause a person to lose their coordination. The person will have a hard time standing up and will be dizzy after moving. According to WebMD, these are ways to keep these side effects from harming you. Making sure you get plenty of sleep, avoiding alcohol and drugs, do not take any medicine unless approved by your doctor, avoiding any physical activities, and many more. CTE is a very popular disease among NFL players that have suffered multiple concussions without properly treating them. According to Boston University CTE Center, CTE is defined as a progressive degenerative disease of the brain found in athletes with a history of repetitive brain trauma. CTE triggers degeneration of the tissue in the brain. The Boston University CTE Center says the brain degeneration is associated with memory loss, confusion, impaired judgment, impulse control problems, aggression, depression, and eventually progressive dementia. In the long run, CTE has caused many retired NFL players to act out in aggression and lash out at people without trying or knowing they are. Concussions are a very serious matter and can cause lifelong changes in an athlete. It is important for all athletes, along with sports enthusiasts, to understand the severity of this traumatic brain injury.